Can a chemical peel help my acne? That's the question that we're going to discuss today. Welcome, I'm Dr. Arthur Kolsky. I'm the founder and medical director of Advanced Acne Institute, a dermatology practice specializing only in the treatment of acne. We don't treat anything other than treating acne, and we have certain observations that we would like to share with acne sufferers who are trying to navigate the path toward clear skin. So we hope you find this information useful, but remember, this is not medical advice. This is only for educational value. We have patients who come to see us, and sometimes they already have an idea of what they want to do. They don't want any medication. They just want to have chemical peels, and they think that that is what they need to address their acne breakouts, and that that will be a solution. So what's the answer? Is that true? Is that all you need to do? So the answer is that chemical peels can be supportive, certain ones. There are different kinds. There's a whole lot of chemical peels that can be had. Some of them are very gentle and mild. Others are very severe and very deep. And so you have to be very knowledgeable about the different chemical peel options before you make a selection about which one might or might not be right for you. But the idea that chemical peels might be the only thing that you need to control your acne, it's not that easy. So sometimes it's true that chemical peels can be helpful, and sometimes they're very important parts of an overall acne treatment regimen. And again, remember what I said, there are a lot of different kinds of peels, and some of them are very, very aggressive, and you have to be very careful and very skilled. And the type of skin that you have can influence whether or not you'll have a good or bad or potentially risky outcome from a certain type of chemical peel. For example, those who have a darker skin type, a darker complexion, they are at more risk of having discoloration if a chemical peel becomes too inflammatory and too aggressive. So you have to be very careful, and that can be a long-lasting effect that could take a long time before the discoloration goes away to a significant degree. It's important to talk with your provider, make sure that they're expert in doing those types of chemical peels, and make sure that they know which one is right for you. Now, it doesn't mean that chemical peels are always the right thing to do, even as a supportive thing, because sometimes other treatments are necessary to gain control over the type of acne that somebody has. And sometimes some of the treatments are contraindicated with certain chemical peels, because you don't want to be taking a medication that might be helping your acne but making your skin sensitive, and then you opt for a chemical peel and your skin may be way too sensitive to accept that peel in a safe way, and you may end up with a very inflammatory, very aggressive reaction that may not be in your best interest. So all of these things are factors that are very important. And in that treatment that you're on could be a topical medicine. There are various topical medicines such as retinoids, which are the derivatives of vitamin A that we use often in treating acne, that can make the skin very, very sensitive. And by combining that with a particular chemical peel can make your skin very sensitive to the peel, and you can get a very aggressive reaction that can lead to a lot of potential side effects on the skin. So there's so many factors that have to be taken into account. So make sure that when you do consider having a chemical peel that you are actually having that with an expert so that you can try to avoid some of these pitfalls. Now, sometimes chemical peels can be very effective and they can help. And sometimes they can be very gentle. There are some that are very lipid soluble, which means they penetrate deeply into the pores where the acne is developing, and they can help to limit the bacterial growth, and they can help to chemically release some of the skin cells that are trapped inside of the pores and in the opening of the pore. And sometimes they can be helpful in limiting acne breakouts. It doesn't mean they always will be, but sometimes they can be. But that's not always the case. So you have to be very careful with selecting the right peel, being under the treatment of somebody who's skilled in managing that peel and managing any potential side effects that might occur after that peel is done. And so all of these factors are risks, and you have to tread lightly, and you have to be very cautious when you make the decision to have a chemical peel on your face, and make sure that you're having that with a provider who has all of the necessary experience and qualifications to treat acne with a chemical peel, a chemical exfoliation, or any other similar type of procedure that might be aggressive on the skin.